Well, I want to thank Cheryl Weeks. She called me and arranged for this. And I know that she couldn't be there this evening because her friend is having a challenging time and she's visiting in the hospital. But it's a pleasure to join you this evening. And she asked me if I would begin by telling a little bit about why I got started or how I got started with my interest in menopause. So I'll share this story with you. Uh, I began my career in the area of reproductive medicine. And I'm a gynecologist, I'm a reproductive endocrinologist, which incorporates menopause, but I was focused on the infertility side of things. And I actually did the first in vitro fertilization in Massachusetts, one of the first in the countries. I was
Wow.
even uh, I was even written up in People magazine for helping gorillas get pregnant at the zoo. But a lot of that changed in 2002. In 2002, my wife found out that she had this BRCA gene. You may have heard of this BRCA gene. And the BRCA gene is known for causing breast and also ovarian cancer. And almost all the women in her family died in their late 40s or early 50s, but they didn't know why. But the gene was discovered, and a study came out that said that if you remove the fallopian tubes and the ovaries, that it would lower the risk of ovarian and breast cancer. And so she had that surgery done. Unfortunately, that surgery came only 6 months after a study was reported. It's a very prominent study called the Women's Health Initiative, or the WHI. And in that study, it said that women who took hormones were more at risk for breast cancer and heart disease. Now, it turns out that that study was wrong. And actually, I've written two books, one called The Estrogen Fix, another one called The Estrogen Window, that explains why that was inaccurate. It was a poor study design, but it cost a generation of women from using hormone therapy to deal with their symptoms. And so as a result, I transitioned at that time from the fertility side to the menopause side. As I say, I used to do sperm to term, and now I do womb to tomb. And in fact, over the last years, I have taken care of over 10,000 women with this issue. And in fact, not only have I been through menopause, I have been through menopause over 10,000 times. So I have my own game for taking care of these issues.
I know.
So, are you able to hear me okay?
Yes, we are. I have us muted. If you'd like to have feedback, we can unmute because
No,
we're
it's
laughing and
fine.
having a good time.
Good, because I hear some people chuckling, but I don't have any idea if everybody can hear. But if you can, then I'll continue. So I thought that the Hollywood Women's Club would have some particular areas that they may want to know about. And I find that most of the times when I give talks, people have questions they wish they knew the answers to. So I wanted to preempt that, and I asked for 10 questions or so, some of the questions that you wanted to have answered. So I thought that we could begin with that. So one of the first issues, or one of the first questions, was what are some of the lesser known symptoms of perimenopause and menopause that may not normally be recognized? So let's talk about that. If we talk about the common symptoms, you probably are familiar with a lot of these common symptoms. Hot flashes certainly are among the most common, and uh, night sweats, which are basically hot flashes, but they occur at night. Uh, irregular periods that are just not typical for a person. Maybe they start to get 7 days longer or wider apart than they were, and then they finally get further and further apart. But it could be heavy bleeding, scanter, or less bleeding. Both can happen. Um, a consequence of that is that people have more trouble getting pregnant. So sometimes women who are trying to have a baby still don't realize that what's happening is that they're going through perimenopause, the window of time leading to menopause. Sleep disturbances, mood changes, irritability, vaginal dryness, very common, changes in libido, memory lapses, brain fog, those kinds of things are not uncommon at all. Those are common. Weight gain, most women will say that they've noticed some change in the shape in their bodies. Joint aches are very common. But some of the lesser common ones that do happen, heart palpitations. You may feel your heart fluttering, and often that happens right before a hot flash. There could be tingling or electric shock sensations. You may notice that there's changes in your hair thinning. Dry skin or itching are very much associated with menopause. Changes in your bladder control. You may have a sensitive bladder. You may know where every bathroom is between your house and the local supermarket or the local shopping mall. Burning mouth syndrome is another one, a little less common. There's another condition where people feel crawling on their skin. That's the term for that is formication. It's not fornication, it's formication. And it feels like you have bugs crawling all over you. And you may have changes in your taste or smell, the way you smell things. So these are some of the less common ones. Most women will only have one or two symptoms, but it's not uncommon to have 3 or 5 or 7. And so I'm going to leave that, and we can come back to it if you want in a little bit. But what natural solutions or supplements have you researched recommended that you found to provide relief for symptoms? Which symptoms are most relieved by natural methods? And comments around natural relief options. Well, it's challenging. I'm just going to leave you with this thought. Everything works for somebody and nothing works for everybody. Oh. Now, hormone therapy, which I am quite experienced with, is quite effective. And despite what a lot of rumors and myths are, and we can talk more about it a little bit, but all the major medical societies now agree that hormone therapy is safe and effective for the majority of women. And so we can talk about exceptions, et cetera, but people shouldn't just come with an innate fear. There should be a reason why they choose not to or to take hormone therapy. Now, hormone therapy has the advantage of treating the sum of you and not just some of you, because estrogen receptors are present on almost all of the parts of the body, the brain, the skin, the breast, the bladder, the vaginal area, the bones. Almost every part of your body has estrogen receptors, so estrogen is helpful for it. But if you choose not to take estrogen or you don't, then we have to go back to taking care of the sum of you. And by that, I mean most treatments, whether they're natural or medical options or alternatives to hormones, are going to treat primarily one thing. And whatever that thing is depends on what your symptom is. So if you are going to do that, you have to remember that menopause comes with 2 kinds of symptoms. Noisy symptoms, I call them, And noisy ones are the ones you know about. You know you're having hot flashes. You know you have a sensitive bladder. You know that you're having um, maiden fog or difficulties of that kind. You're very aware of it. But you may not be aware that your bones are thinning. You may not be aware that your heart is being starting to experience hardening of the arteries, atherosclerosis, etc. After all, heart disease kills 10 times more women than breast cancer. And so many times women are worried about breast cancer, and they should be, but they don't think as much about heart disease. I have a whole book that I've written on soy. It's called The Soy Solution for Menopause. Soy is available either as a food, which I recommend is a great way to get it. There are all kinds of soy supplements out there. There are lifestyle changes you can make. Exercise is good. Eating whole foods is good. Having a more sleep is good, and that's one of the symptoms of menopause. Getting more sleep, though, is excellent for improving symptoms and for your health, and lowering your stress. And of course, today, almost everybody is stressed about something. All you have to do is turn on the television and you feel stressed. So I would say that if you're going to try supplements and those kinds of things, as I said, everything works for some, nothing works for everyone. Try one thing at a time. Try it for 1 to 3 months. If you're not satisfied, get rid of that one and get another one. If you start mixing and matching, you're not going to know what's helping you and what's not. And it's just going to be confusing, and it gets more and more expensive every month. So that would be how I would go about that. The next question is, why do UTIs occur more frequently during menopause, and what you can do to be proactive in preventing them? I'm going to tell you that's one of the most important questions that you could ask. UTIs, or urinary tract infections, get particularly prevalent as women get older. Why is that? Because if you're not taking estrogen and you go through menopause, the hallmark of menopause is you have less estrogen. And that estrogen has a very important effect on the pelvic organs and the vaginal tissues. So what happens is the urethra, the little tube where the urine comes out, is usually flush with the outside of the vulvar area. In other words, it doesn't stick out. It's just there, covered by the tissue, or just flush with it. So if this were the vaginal tissue and this, my finger here, were the urethra, it would end just like that. But as menopause happens, those tissues start to shrink and they start to get narrower. And then what happens? This urethra is sticking out. And so it gets into the bacteria in your underwear. Some people are not as careful when they wipe themselves and so forth. But just by this experience happening, urinary tract infections increase. And as a matter of fact, if you look in assisted living places, it's very common. If you look in places where nursing home facilities, sepsis, by that I mean infections throughout the body, are very common. A lot of women die because of this problem. They get urinary tract infections that spread to their bloodstream, and they get sick and they die. So if you use vaginal estrogen, even if you don't want to take it for your whole body, vaginal estrogen, we'll call it local estrogen, however you want to term it, is very effective in restoring that tissue and making this change to that. And as a result, you end up with a greatly reduced risk of illness or death. So I do know that Local estrogen is as good as antibiotic taking for lowering your risk of urinary tract infections. Matter of fact, when I coach women and I have people that I talk to through menopausecoaching.com and help them make plans for themselves and to work with their doctors to become more of a partner. This is one of the things that gets talked about a lot, how to do it, how much to use, etc. And it's something you can really do to be proactive. What treatments are available to address thinning, loss of elasticity in the vaginal tissues during menopause? Well, we kind of just talked about that one. So I'm not going to stay on this at this time because we talked about it. There are for moisture, if you're just having a problem of dryness, there are a number of over-the-counter products. There are some that are non-hormonal if you just don't want hormones. Replens is one that's there. There are other ones that have DHEA in them, local DHEA that is available. There are a number of products that are out there. You have to see what is working for you, but again, one at a time. Vaginal estrogen definitely will work for that. What treatments or options are available to address hair loss and thinning? Hair loss is another issue that's very common in women, and it is more common towards menopause. One of the there are a lot of reasons. I mean, there are endless reasons. The first thing to do is look in your medicine cabinet and see what the side effects are from everything you're sticking in your mouth as a pill or over-the-counter product. Some of those will cause it. The second thing is that about 20% of women have a low thyroid. Most of them don't know it. Low thyroid causes hair to fall out. So I would consider having your blood checked for thyroid hormone, TSH. Vitamin D, you're in Florida, but a lot of women in Florida are wearing long sleeves and they're wearing a lot of sunscreen and they're not getting as much vitamin D produced, and the vitamin D is made in the skin. So you might check your 25 hydroxy, that's OH, vitamin D, and see if you're low in vitamin D. That's another cause of hair loss. Stress can be a cause of hair loss. And there are a whole host of autoimmune conditions and other medical conditions that affect this. Of course, some women have too much androgens, quote, male hormones. And usually, if it's more of a natural thing or the kinds of things that I've been talking about, then the hair will be with the same front line, but it's going to be thin throughout. In other words, when you part your hair, you'll see the part is getting wider, etc. But the too much androgen, too much male hormone usually comes with what's called male pattern baldness. And that just means that, it goes up like this. Your hairline goes up like that. So sometimes dermatologists can help you if they're knowledgeable about this, and they can give you medicines or first, if it's too much hormone, that needs to be addressed, and that can be addressed. But if it's the thinning out, check the thyroid, check your medications, and the other things I mentioned, and then you want to go and talk perhaps to a knowledgeable dermatologist who might be giving you some things that can help fill in for hair thickness. How do you address brain fog and memory loss? A lot of women will complain about hot flashes, but if you peel back the layers, most women are worried about something a heck of a lot more than they are hot flashes. And they're worried about hot flashes a lot. And that is, they're worried about, have I got dementia? Everybody's got an Aunt Jane or Grandma Betty or somebody who has dementia. It's unfortunately very common. And when women go through this window of time, the changes in estrogen primarily is the culprit. And for a window of time, it's very hard to ignore that that is happening. If you are on hormone therapy, it'll be less of an issue or may not occur. But if you are not and you're in it, the good news is that as you go through the cycle of menopause, you're actually going to come out on the other end and you're going to be just as smart and good and everything able as you are. But before it was masked a little bit. So you will pass through this phase and just realize that, but it can be addressed. And about 98% of women who have this have menopause. They do not have dementia. So if you're really worried, are the symptoms continue to persist, evaluate for dementia. But probably it isn't that, which is good news for everyone. What treatments have worked to help anxiety and depression or other mental health challenges? I spent 6 years working part-time in the psychiatry department. I was a 25-year member of the Harvard Medical Faculty, and I spent 10 years at the University of Massachusetts. And 6 of those years, part-time, I was in the Department of Psychiatry part-time. And I dealt with all of the women who had medical level anxiety, depression, and a whole lot of other mental health conditions. Generally speaking, anxiety is one of the most common menopause mental health issues that happens. It's very common. Even anxious women get more anxious during perimenopause, during that window of time. It's something that happens. And also depression. There's a difference between feeling sad and feeling depressed and having clinical depression, which means you actually have 2 weeks of really reaching the bottom. That's a clinical diagnosis, and your appetite is totally affected, your sleep is affected, so many things. There's a definition for clinical depression. But depression is pretty common, and anxiety in the sense, but not the clinical depression. But those two things or other mental health issues often get worse, particularly if you're someone who had postpartum depression, if you had terrible PMS. Those are times, those are the settings that are clinical depression before menopause. So you need to work with your healthcare provider to get help for those things. There are treatments. Again, I'm not selling hormones. I do not make any money off of hormones. I know about them. I talk about them. I write about them. But if you do go on hormones, that typically will help. And if you go on hormones and you need an antidepressant or an anti-anxiety, the hormones will help it. It will amplify. It'll bump it up. Also, if you're on the anti-anxiety or if you're on hormones and you still are feeling anxious and a little sad, adding the anti-anxiety or antidepressants will bump up the hormones in that arena. So it's not a guarantee, but I know if I'm working on the psychiatry floor, from all the women I saw with manic depression or with severe depression or all kinds of mental health issues, treating the menopause condition help their mental health. So I recommend that you look into that. How long do symptoms persist? Mark Twain said all generalizations are inaccurate, including this one. So I can only tell you that for most women, they last for about 5 to 7 years, but the range can be 10 years. And for some lucky individuals, they can be a lot longer. So it's quite variable. But for the majority of women, 5 to 7 years is when it's going to be peak. And interestingly, the symptoms really begin in somewhat intense fashion before menopause, because menopause, by definition, is 1 year after your last menstrual period. And usually the symptoms are really kicking in about 1 to 3 years before that. And they will continue for another 2 to 5 years after that. And that's when the rubber meets the road, so to speak. That is when it's most intense. But again, that's a generalization. 20% of women will have no symptoms. Um, why do healthcare advisors often overlook symptoms and fail to discuss your age and personal experiences? It's a real issue. That's part of the reason that I started doing the menopause coaching, because only 30% of gynecologists today get any training at all in menopause. And of the primary care, less than 15%. Now, these are the most of the doctors that most women are seeing for their what would be menopause symptoms. So they don't often either have the information, they're not comfortable asking questions about sexual issues or vaginal dryness or many of the other things. They're not prepared for it. And of course, time is a factor, because people are always in a hurry in the doctor's office and they have more people coming. And, it gets to be just not enough time for talking. The truth is, there's not enough time for listening. And so it's very important to identify people who you can work with that can help you get through this particular time in life, because there are treatments for almost every symptom. Last question here is, if women decide to seek HRT, how long can she generally expect to have to be on? Again, it's really a generalization, but I mean, there's no reason that you have to come off. You can stay on them indefinitely unless you develop a certain problem or medical reason not to. The fact of the matter is that the most important part is when you start them, not how long you stay on them. And as my books show, the estrogen fix and the estrogen window, the most important thing about this is the time of initiation, when you start it. So if you are close to menopause within the first 5 to 10 years of your last menstrual period, that is the safest time to start it. And if you do that, as long as you are continuously taking it, then there's no rule that says you must come off. But if you wait in 10 years or 15 years after menopause to start it, then your body has been aging during that time. And so then there are potential risks. And so you want to begin in what I call the estrogen window. When is the best time? And then you can stay on it, and then you can come off of it if at any time you want. About 30% of women, 30, will start having symptoms again. About 70% will not. So these are things to work on and have a strategy for. But let's stop here and open it up if there's questions or things that people want to ask so that we can interact a little bit. Was this helpful to you?
Yes. Yes, thank you.
Dr. Seibel, can you hear me okay?
Very well.
There's a discussion in the zeitgeist right now about creatine and its impact on brain fog. Have you heard about that? And do you know any association of helping with brain fog?
Well, a lot of people are taking it, and I'm not an expert on the data on that, but there is information suggesting it's helpful. Generally, you put a scoop in a little bit of water, and in 8 ounces of water, and have it once a day. And a lot of people are saying that it's quite good. I don't see any downside to it, and so I say go for it. But I don't have a ton of data to give you off the top of my head, other than what I've just said.
Thank you.
Dr. Seibel, do you have any knowledge of body odor also being a symptom of perimenopause or menopause?
For some women, that is a bothersome side effect that can happen, and the bacteria in the body change because of the hormonal changes, and bacteria usually are the cause of the odor. I mean, they're not the kind of bacteria that are causing disease, but they create uncomfortable experiences, and for some people that'll be just an odor of their body per se. For some it may be more vaginal in origin. If it is vaginal, then you do want to get at least have a culture taken and make sure that there's not some kind of condition that might be problematic for your general health. And I would recommend you be seen once. I mean, you don't have to keep going back and back and back. It's not an ongoing thing, but unfortunately that can be an issue.
So the question is there something, so we have some younger people in the audience, and they're asking, like, what could they do to prepare or to make it smoother as they're moving forward? Like, they haven't reached perimenopause yet?
Yeah. Well, there's a lot of women that first of all, when does menopause happen? A lot of people think it happens in, quote, older women. The mean age is 51. The range is 45 to 55. Some women won't go into menopause until they're 65 or 64 or 63. But up to 10% of women will already be in menopause before they're 45. And 1% are going to go into menopause and already be in menopause before 40. And so the symptoms of perimenopause can begin as much as 10 years before that. So symptoms can begin in late 30s, early 40s. That would be not uncommon when they may still be trying to have kids. So that's why all of these things matter. Right now, the older millennials are now in their early 40s. They are entering perimenopause, many of them. So you want to, the things that you want to do, the simple things, I would get a bone density, because, as I said, if you're a healthy, I don't know if I said this to you, but if you're a healthy 50-year-old, you're just as likely to die of a complication of a bone fracture as you are of breast cancer. That's a pretty big statement right there. So you want to get a bone density. It's painless. Your primary care doctor will say you don't need it until you're 65. If that's the case, get a different primary care or just pay for it, because you need a baseline in order to know if you're losing bone or not. I would get some type of keep an eye on your blood pressure, keep an eye on your cholesterol, your lipids, because this is going to have to do with your heart, and heart disease kills 10 times more women than breast cancer. And maybe get a baseline EKG, and just make sure that you're getting your mammograms on time appropriately, a colonoscopy at the appropriate time. Now they're saying age 45 for colonoscopies because colon cancer is happening in younger and younger people. And I would take a multivitamin, and I would take probably vitamin D. I'd certainly check my vitamin D. And these are, and calcium potentially, because you're going to start losing bone at this point in time. You lose about 5% of your bone over the years of perimenopause, and so you want to try at least have adequate calcium intake, and that can come from supplements or from food. Just make sure you want to get about 1,200 milligrams a day.
Any other questions?
When you say the main things, you really need to have a good primary care doctor and gynecologist because there are so many treatments that are available. Like the Votiva for your vagina, vaginal rejuvenation for the skin, all of those things come into play. If you have a really good doctor, they will know those things.
I'll tell you what, I'll put my estrogen locally in the vagina against all their vaginal rejuvenation, and we'll see who comes out ahead. Save you a lot of money.
In your experience, right? I'm going to start with that. And this is actually, we have a former surgeon in our house. Her question is, if you have a family history of breast cancer, what is the risk of local estrogen?
Local estrogen is safe. A family history of breast cancer is of no consequence at all for this. As a matter of fact, estrogen and vaginal estrogen has been shown to be not increase the risk of recurrence or death in women, even who have estrogen receptor positive breast cancer. So I'm not saying start there. There are other options for vaginal dryness and so forth, but for a family history of breast cancer, even women with the BRCA who have had their ovaries removed for being a previvor to lower their risk of getting breast cancer because they have these different genes, PALB2 or any of these other genes. Taking estrogen, even orally or as a patch, does not increase the risk of breast cancer beyond the risk that the genetic predisposition gives them. But taking estrogen doesn't increase that risk. All of this is myth. All of this is myth.
Any other questions?
You may not believe me. You may not want to believe me, but data backs it up.
So the question is, how does exercise factor in as a preventative into all of this with menopause and what have you?
Exercise is fantastic. Exercise is good. It lowers your risk of recurrence of breast cancer if you have breast cancer. It lowers your risk of depression. It's actually as effective as antidepressants for mild depression. It helps to prevent the muscle to fat exchange, what's called sarcopenia, when people are having muscle weakness so that as they get older, they can't even get off the ground. And if they sit or fall. So exercise is terrific. It's good for your heart. It's really important. And with that exercise, I would encourage you to eat protein. You ought to be getting close to your weight. And if you weigh 140 or whatever you weigh, you ought to get 140 grams of protein. If for some people, they may even need more per day. And you need to log that because you need that to build your muscles. You need to do muscle building. Muscle building is really good for maintaining your strength and your muscles because you move because your skeleton is there, and your skeleton gets you from point A to point B. But the muscles move your skeleton. And so you ain't going nowhere when you lose your muscles. And so it's very important to get the protein you need, get the muscle building that you need. You don't have to do, big weights or anything. Get 2-pound weights or whatever you can do and just use them regularly and, keep your shoulders moving and you can do any kind, sit in a chair and then stand up, sit in a chair and then stand up, or do more, without the chair, do squats, do things that keep your muscles strong and keep you moving, and walking every day. You don't have to run the Boston Marathon, just walk. Can't walk too far, walk to the corner. If you can't walk, mean that if you can walk to the corner and back, then walk, around the block. Increase it in increments. But these are the things it's your habits that are going to keep you healthy and they're going to keep you alive. Those are healthy habits, and habits have to be done regularly. They're habits because you're doing them every day or 5 days a week. And just find a way to enjoy it. Find a friend that has the same mindset and do it with your friend. And that will help you, be accountable and to do it regularly. Because those are the things that are going to keep you young and keep you moving.
Dr. Seibel, that's a perfect ending to wrap up. Here at the Hollywood Women's Club, we have several different things that we already talked about with our weekday walkers. We have a TY walk every month. We have yoga twice a month for our group. So we have lots of those things. I think our president would like to have the final word here.
Yeah, Dr. Seibel.
Before you come on, I'm going to say that I have put in the chat a link to a free issue of the Hot Years magazine. It's the #1 digital magazine for women in midlife. And I've been doing this for the last almost 15 years. I do it, my wife and I edit it together, and we go to meetings and cover the meetings as press, actually. And so I'm giving you a free issue. And
Thank you.
if you like it, you can subscribe. But if not, at least read this issue. I think you'll find it helpful. And I would say that if people are interested, if they have a need or they want to explore it. I mean, I work a lot with business and professional women and women executives who are struggling with midlife issues or challenges and want to get back in control of their lives, their work, their relationships. If people are interested, they can contact me at menopausecoaching.com, and I'm happy to see if working together is something that would be helpful for you.
Thank you so much, Dr. Seibel. I really appreciate you taking the time to talk to us. And I think answering our questions up front was extremely helpful. Again, thank you so much for your time, and I'm sure some of us will contact you.
Well, I wish you all the best, and thanks, Cheryl, for reaching out, and continue the good work at the Hollywood Women's Club.
Thank you.
Thank you. Thank you very much.
Have a lovely evening.
Bye-bye.